Sallu ala Habib sallallahu ta'ala ala Muhammad sallallahu ta'ala alayhi wa alihi wasallam. Dear viewers of social media, welcome back again to our Leicester Fazane Medina Facebook page daily live session with me, Dr. Zira Qatari. I'm your host. In our silsila today, Health is Wealth. Alhamdulillah, this Health is Wealth segment is every Wednesday, Friday, and Sunday, where we try to get different doctors to talk about those medical problems or mental health problems that affect us on daily basis. And aim is to educate the public to a basic understanding so that they can help themselves and other family members prevent take the preventative measures. So this is from medical point of view is called primary education, and that is the aim of our Health is Wealth segment. And Alhamdulillah, on other 4 days we come with different topics where we talk about our Fazan Medina or other services of Dawat Islami and so forth. So Alhamdulillah, today I am pleased to announce that we have with us Dr. Imran Attari. He is, mashallah, a specialist doctor in old age medicine. He is currently working in hospital as a specialist in old age medicine. Dr. Imran, first of all, Assalamu alaikum wa rahmatullahi wa barakatuhu, and welcome to our program.
Waalaikum assalam wa rahmatullahi wa barakatuh.
Thank you very much for taking the time out. May Allah Azza wa Jalla reward you. I'd like to mention a hadith of the Prophet sallallahu ta'ala alayhi wa alihi wasallam. Khairun nasi man yanfa'un nas, that the best amongst the people is the one who benefits others. So inshallah Azza wa Jal, medical profession is something that helps us to educate other people and to look after their health so that they can worship Allah Azza wa Jal in the best manner possible. I'm sure people will be able to benefit from your advice today. Now, the topic obviously today is elderly health problems. Now, clearly, old age comes with lots of problems, lots of physical health problems, lots of mental health problems, and inshallah Azza wa Jal, we will try to cover some of them. It's a very vast area. There's no way that in half an hour we'll be able to cover everything. But please do join us, do like our Facebook page, do share this with your friends and family. Now, clearly, majority of us have got parents who may be elderly, whether they're young old or middle old or old. What does this mean? Clearly, anyone over the age of 60, 65, they now enter into the old age. So anyone in their late 60s is young old. Then obviously from 65 to 70 or plus is middle old. And I think if it's 80 plus, I may be wrong, but Dr. Imran, do correct me. I may have forgotten my these age ranges and so forth. But anyway, today we will be talking about elderly problems, medical health problems in the elderly. Particularly, we'll focus on the falls. But first of all, Dr. Imran, mashallah, you work as a specialist doctor and you look after elderly patients in the NHS. From your experience, from your clinical experience, what sort of problems you see most commonly that the elderly people get admitted into hospital?
See, this is as you mentioned, Dr. Zirak, this is a vast area, and the common problem is the frail patients which come to the hospitals. These patients, we have in the NHS have a separate ward for these patients, frail patients, and these patients have got multiple problems, which obviously we can't cover in one program, but mainly the frailty, frailty is the term for the patients who have got problems medically, functionally, socially, or psychologically. So the frailty term, as the brother mentioned, geriatric. Geriatric is age related. So age is the cutoff age is 65 above is called the frail patients. So frail patients have got multiple problems. Firstly, they have got diseases. There could be any chronic diseases, and there could have been loads of patients. and which can contribute to their functional decrease in function, decrease in mobility, and stuff like that. Secondly, their age. The more aged they are, obviously they would have got more requirements to do day-to-day works. And then we see these patients have got frail patients. They present with a falls, and falls is quite common in the elderly patients, and they uh, come with a falls. They hit the head. They could have a bleed in the head, and these falls could. And then we have to sort out what is the cause of their falls. Falls could be many problems underlying the files. It could be chronic diseases. It could be because of their eyes, they could not see properly. It could be because of their ears, the balance problems. Any diseases in the ears can cause these problems. Then their diet related, what their diet is. Then what food they are taking, what medications they are taking, their side effects, then how much support they've got from the family, have they can they do shopping, how much work they can do, and how much their toiletries are, and their smoking, and then we can call one over other subject, which is Dr. Sab is well known, is isolation. They're sitting in the house in the isolation. They are not getting support from the family and friends.
Okay. Jazakallah khair. Thank you very much for this comprehensive sort of summary in terms of the problems faced by the elderly. And you touched upon the falls as well. So you mentioned clearly. अच्छा मैं थोड़ा उर्दू में भी अर्ज करता हूँ ज़ाहिर है कि हमारा एल्डरली के लिए जो है वो प्रोग्राम है तो यकीनन हमारे कई एल्डरली व्यूअर्स भी हमें देख रहे होंगे तो बड़ी उम्र जो है बुढ़ापा ये बहुत सारी बीमारियों के साथ आता है हमारे मियाँ साहब का एक शेर है मियाँ मोहम्मद बख्श रहमतुल्लाह अलैह का अच्छा मियाँ साहब के अशार में डिफरेंट डिफरेंट अल्फाज नेट पर मौजूद है तो हो सकता है अल्फाज आगे पीछे हों तो मियाँ साहब फरमाते हैं कि गई जवानी आया बुढ़ापा जाग पियां सब पीड़ा हून किस कम मोहम्मद बख्शा सौंफ जवैन हरीड़ा so Mia Muhammad Bashir Rahmatullah is obviously pointing towards that fact of life जिंदगी का जो एक फैक्ट है कि जब बुढ़ापा आता है तो इसके साथ साथ जो है वो दर्द तकलीफ और ये सारी चीजें जो है वो आना शुरू हो जाती हैं अब जाहिर है कि देखने में भी प्रॉब्लम होती है सुनने में भी प्रॉब्लम होती है बैलेंस में भी प्रॉब्लम होती है और फिर जाहिर है कि कमजोरी भी होती है हड्डियां भी कमजोर होती हैं तो अनीमिया वगैरह होता है तो इससे जो है वो चलने फिरने में दुश्वारी होती है तो बंदा गिरने का खदशा होता है तो गिरने के हवाले से जो है वो इस हवाले से जो है वो डॉक्टर इमरान ने जो है वो हमें बताया तो फॉल्स जिसको इंग्लिश में फॉल्स कहते हैं तो falls के हवाले से Dr. Imran, I would like you to mention a little bit more the what could be the causes of falls and when an elderly patient does have a fall, what problems there are in terms of getting in touch. Could they actually be lying in their home for hours or days? And when they come into hospital, so just take us through the steps that what causes falls after the fall, what sort of problems you've experienced in terms of elderly patients that you've seen, and in hospital, what complications?
So falls, as Dr. Saab, you asked about falls. Falls is related with the age related. Again, the age problems, the multiple chronic diseases, what the diseases they have got, and they're taking the medications. The acutely there could be infection, which can cause this falls problem. Then the blood pressure, which is going up and down because the medications are obviously controlling the blood pressure. But sometimes what happens, the blood pressure system doesn't work, and commonly in the elderly patient, the blood pressure goes down, which we call it as a postural hypertension.
Mhm.
And this can cause common problem in the elderly. Like I mentioned about the diet, the anemia related problems, because they have not been being looked after. They live in on their own. They live in isolation. and they have not got family support. They're living on their own, so they have got anemia, which can cause these problems. And like your brother mentioned about the ears and eyes, and they can cause they have not got good vision, or they have got balance problems which is related to the ears. So all these things, they obviously layers with their GP, and they have got all these things on their records. So whatever problems, these all problems can lead to the falls.
Mhm.
And what happens with the falls, when they start falling over, then there's risk that they're going to bad, and they could end up with a big bleed, or they're going to break their bones, and they could end up having a fracture of the femur, which can lead to their life independency. They could end up in a nursing home, in care home. Then they when they keep falling over, then they come to the hospital, and we assess them from the medical point of view, from the functional point of view, from their social point of view, and from their psychological point of view, how we can help them, these patients.
Okay, what can the family members, and obviously we live here in Britain, where we have a mixture. Some families, they are very supportive towards their elderly. We're very committed, whether they are ethnic minorities, whether they are obviously white Caucasian population. So you see examples. I mean, in my clinical practice, I have seen huge examples of commitment from the children towards the elderly. So there is a mix up. Some elderly are really well looked after by their children and other family members, and unfortunately, in some cases, so the elderly do tend to live on their own. What can the family do to help their elderly or their loved ones from preventing their falls?
The loved ones, they are the important ones which can help the moms and dads, their aging parents in their family. And alhamdulillah azawajal, if you have got a madani mindset, like we say in the Dawah Summit terms, you have got good mindset, you can help your parents. And what you can help them, you can help them looking after going up and down the stairs in the house, whether they can walk without any stick, or whether they need a stick, whether they need a physiotherapist assessment. And then they need to be looked after in terms of their eyes. They would have their vision checked in the center, and that can the families and relatives, they can do that. Their sons and daughters, they can take them to the eye vision checkup. And then their ears, they can cause problem because they might need hearing aids. And then the family ones again come in this scenario, and they can help their loved ones. And then the family ones, the important thing is they are being fed, because when they are sitting on their own, they are not doing anything. They need some feeding properly at the right time every day. Because what will happen, we don't want them to lose their weight, and then if they are losing their weight, then can again lead to the falls. And especially the medications, whatever the medications have been prescribed by your GP, that needs to be looking into as well. What medication they are taking, and either they are medication taking on time or not. And then they need the GP appointments.
Okay, we are experiencing some technical difficulties. I have obviously from my side been trying to work very hard. Looks like Dr. Imran's disconnected at the moment, so
And
hopefully.
the GP
So let's wait for him to rejoin.
Madin,
Um, जी डॉक्टर इमरान सॉरी देयर वाज सम
sorry.
कनेक्शन प्रॉब्लम सो क्लियरली फ्रॉम अ फैमिली की तरफ से जो डॉक्टर इमरान ने अभी मैंने कहा कि भाई वो अपने पेरेंट्स के हवाले से एल्डरली पेरेंट्स के हवाले से बिलखसूस अगर उनकी नज़र का चेकअप करवाएं उनको जीपी के पास लेकर जाएं ऑप्टिशियन के पास लेकर जाएं कानों के हवाले से चेकअप करवाएं इसी तरह उनकी जो दवाइयां हैं मेक श्योर करें क्योंकि ज़ाहिर है कि बड़ी उम्र के साथ बुढ़ापे के साथ जो है वो मेमोरी प्रॉब्लम भी आती है तो बिलखसूस फैमिली वाले उनकी दवाई पर नज़र रखें ले रहे हैं नहीं ले रहे फिर इसी तरह बाज़ दफ़ा क्या होता है कि दवाई लंबे अरसे से प्रेस्क्राइब हुई होती है, उसका रिव्यू नहीं हुआ होता, ब्लड प्रेशर की दवाई है और अगर फॉल हो रही है या वो डिजी फील कर रहे हैं तो अपने जीपी से उसका चेकअप करवाएं. We've got questions coming as well. There are two questions. I'd like to take one here from Riaz Isa bhai. Riaz Isa, mashallah, is a dedicated viewer of our social media page as well. He says, what would you recommend to motivate the elderly to exercise at home? Now, if you'd like to explain the importance of exercise for the elderly, the cares they need to take, and how, as family members, we can motivate them to do regular exercise, and will that be beneficial?
Exercise is very important in this subject, and it depends how much they are mobile. And family again comes in this play part in this, because they can take them outside to make sure that they can walk around okay. If they need a sport with a stick or anything else, they need to be checked on by the physios and your GP and stuff like that. They need regular exercise, especially if they're chronic patients like heart patients. They need more exercise important than the other patients. So because if they're active, then they would be do their day-to-day work. Otherwise, what will happen, they will end up immobile, losing their muscle mass, and then in the end ending up in a nursing home, which is not the good for all of us, especially for the family members. So they need to be mobile and active to get the energy back. And if they are mobile and active, obviously, then they would look after themselves, and they will feed themselves more as well. And then exercise really good in helping these old patients.
How do we motivate? Now, clearly, elderly patients, we ask them to exercise. They say, oh, I've got this pain, or I don't feel stable enough. Some of them who have had a fall, now psychologically, they will actually be afraid of obviously walking. So, as a family member, and you know what, clearly we will need a lot of guidance from the doctors as well. So, how can we motivate our family members to exercise more, elderly especially, and young as well?
Yes, obviously, the family members, they will give them motivation, the passion to go out. And I know the old age, they tend to stay in the house. They don't want to do anything. Well, alhamdulillah, Zawjal, if they have got good religious mindset, what they will do is start reading namaz, which is alhamdulillah good exercise for them as well. They start reading nafals. So if the family members can give the jazba, the passion, hopefully they will start moving on, and they will go outside to do the exercise. For example, see the exercise, if they are diabetic and they are doing the exercise, that will balance their blood sugar levels. Otherwise, what will happen, the blood sugar level won't be balanced, and they would have got hypoglycemia or hyperglycemia, like low blood sugar levels or high blood sugar level, which will what it will do, that they will end up in the hospitals. And similarly, if they got chronic heart problem, heart disease, they need exercise. If they don't do it, then there is a risk that it can promote their it can promote, and it can lead to their hospital admission again in view of heart problems. And especially if the elderly they are smoking, and they're not doing exercise. Smoking is causing, or they have smoked in their lifetime at some point, and what that would have done, that would have damaged the heart and the lungs. And if it has damaged, then, and they're not doing exercise, they're not moving on, this can cause problems to their mobility, and it can lead to falls, and it can lead to the hospital admission.
माशाल्लाह, इसका मैं थोड़ा सा उर्दू में भी कर देता हूँ.
Then
माशाल्लाह, बड़े अच्छे तरीके से डॉक्टर इमरान ने जो है वो मोटिवेशन के हवाले से बताया कि जो हमारे बुजुर्ग हैं, बाज़ दफ़ा उनके ज़हन में होता है कि यार मेरी तो अब मैं गिर ना जाऊँ, मुझे डर लगता है, मुझ में हिम्मत नहीं है, मुझ में ताकत नहीं है, तो मैं उठ नहीं सकता. देखें, ये एक्सरसाइज से हिम्मत और ताकत आएगी. अगर एक्सरसाइज नहीं करेंगे तो पट्टे जो है ना, ये कमज़ोर होना शुरू हो जाते हैं, उससे ताकत भी नहीं रहती. फिर जब हम चलते फिरते हैं तो इससे हमारे जिस्म में जो ग्लूकोज है उसकी मिकदार कंट्रोल में रहती है. इसी तरह फिर आपको पता है कि डायबिटीज भी बूढ़ों को हो जाती है, हार्ट प्रॉब्लम्स भी हो जाती हैं. बिलखसूस किसी का अगर हार्ट फेलियर है, दिल सही तरह से काम नहीं करता, उनके लिए भी बहुत जरूरी है कि वो एक्सरसाइज करें। एक्सरसाइज से एक जब पट्टे कॉन्ट्रैक्ट होते हैं तो हमारे जिस्म के अंदर फ्लूइड जो है ना, ये सही मानों में जो है वो गर्दिश करता है। तो एक्सरसाइज बहुत जरूरी है, इसको प्लीज आप करें। जितना एक्सरसाइज आप करते रहेंगे, जितनी आपसे हो सकती है, कोशिश करें कि बाकायदगी से करें। अगर आप उसको ब्रेकअप कर सकते हैं 5 मिनट के लिए, थोड़ा घर के अंदर चल लिया, या थोड़ा गार्डन है तो वहां चल लिया, या अगर फुटपाथ है तो वहां पर चल लिया, जो मोबिलिटी एड आपको चाहिए वो आप यूज करें। और अगर आपको फॉल्स वगैरह होती हैं या चक्कर आते हैं तो बिलखसूस अपने डॉक्टर से जरूर जो है वो चेक करवाएं। So this was about the falls. So an individual, an elderly patient who has a fall and gets admitted into hospital. Now, clearly you mentioned about, obviously this could lead to head injuries, bleeding in the brain. This can also most likely break their bones, because with elderly the bones will be brittle. So now your specialty is purely from a medical point of view. What options or what help is available that the medical team does give to the elderly patients when they are admitted as a result of a fall, and what sort of community services are there to help?
Yeah, firstly, these patients, when they are obviously unwell, they need to see their GP as soon as possible. But when they are admitted in hospital, what we do, we have to see the 3, 4 different types, which we have to streamline all these 4 different things where we can help them. Firstly, is the medical side of the things. So medical side of the things, like I said, we need to see the acute infection which needs treating with antibiotics. We need to see their chronic disease patterns. If the chronic diseases are playing up, we need to sort them. Then, if they have got falls and which is and they are not mobile, we need to see those ones why it are happening. We need to see the medical side of the falls. Then blood medications, and we need to see their eating patterns, whether they're eating well or not, and we probably need to involve the dietitian as well. Then we need to check their medications, if the medications need tweaking up and down, or they need stopping because they're causing them problems. Then the secondly come in the functional side of the things. From the functional side of things, we need to ask our physiotherapists and occupational therapists, which can help and see how much they need help in mobilizing around. And the occupational therapist, what they do, they see their the living house where they're living, and they check what help they need in there. And then comes the social sides of the things as well, which how much care they need in the house. For example, if they're not mobile, uh, can they feed themselves? Can they use the toilets? Can they walk around? So all these things will come in with the help of physiotherapist, occupational therapist, the social help team. And what happens in this specialty, the community specialist, the community old age specialist, which can work in the community, so they can prevent these patients coming to the hospitals. So all these, whatever we do in the hospital, we they can liaise back all of these steps to the GP, to the specialist nurses, to the physiotherapist, to the occupational therapist, to the community geriatrician. So they are all linked and attached with each other. So when the patient goes out from the hospital after having a admission, we just need to make sure that he's getting the best treatment, the best possible placement where he can live independently and gets the support from the family and the friends. That's what
Mashallah.
we tend to do with these patients.
Mashallah, Jazakallah khair. I've got two questions. One is from Asif Bhai and one's from Ilyas Bhai. I'd like to take the Ilyas Bhai's question first, which is on the screen. That with some elderly who are sedentary, meaning they're sitting down, there's a risk of, or for example, they have had a stroke and they're lying down on the bed. So there's a risk of pressure sores developing. A very important issue with elderly. So can you touch upon how we as family members do in regards of prevention, but also in regards of what signs to look out for? Very important question.
Yeah, this is very important question that brother has asked about, is touched upon about the pressure source. The family members, what they can, with the help of GP advice and the specialist advice, they can turn these patients. They have to do, every hourly they have to do turns, and they have to see which position they have been in the bed, and if they are in bed bound, they need more help, because they need turning around to save from these pressure sores. Because what happens, a number of these patients, they get admitted into the hospital with the infections from the pressure sores, which is not really ideal scenario for us either, because obviously we end up giving antibiotics. So if the family members, the loved ones, they look after them and keep turning them around, with the advice from their GP and the physiotherapist, that will really help them, saving the pressure sores. And what the other things we can help with the help of occupational therapists. The occupational therapists, they can advise about the bed mattresses, and they can have got special beds, so they save themselves from developing these pressure sores. So all these things, they obviously need advice from your GP. From your GP then can liaise with the physiotherapist, liaise with the occupational therapist, and the specialist nurses in the community, and they can advise what we can change things, so they don't develop these pressure sores.
Are there any particular points on the body where they get these pressure sores so that the family can keep a regular checkup on these particular areas of the body?
There are like the sacral area of the body, like if you see yourself in lying position, the areas which are the most vulnerable ones. The first one is the sacral area. Sacral area is the lower,
Lower
your
back.
lower back area,
Ji.
which is the vulnerable. Then secondly, your the heels, the back of the heels, which is very vulnerable. Then back of your elbow joints, this is very vulnerable. So these areas quite vulnerable areas, and they are the common ones to develop pressure sores. So if they can put a like a pressure balloon under these areas, that can help in saving us from developing from these pressure sores, and not to develop any infection in these pressure sores.
अच्छा, इसमें मैं उर्दू में अगर अर्ज करूं तो जिस्म के स्किन जो है ना ये जख्मी हो जाती है, जिससे छाले बन जाते हैं या जख्म बन जाता है। इसको प्रेशर सोर बोलते हैं। और बिलखसूस वो मरीज बड़ी उम्र के हों या वैसे हों जिनको फालज हो जाता है, मूव खुद नहीं हो सकते, या बेड बाउंड होते हैं, ओवरवेट होते हैं, हार्ट प्रॉब्लम्स होती हैं, मूव नहीं कर पाते, तो जो अक्सर वक्त अपनी बेड में गुजारते हैं तो उनको ये प्रेशर सोर्स हो जाते हैं। बिलखसूस डॉक्टर इमरान ने कहा कि जो है वो लोअर बैक जो होती है बटक्स के करीब, इसी तरह जो हमारी हील्स होती हैं, एल्बोज होती हैं, तो फैमिली मेंबर्स को चाहिए कि वो इस हवाले से जो है वो इन हिस्सों की अच्छे तरह से जो है वो देखते रहें। और मरीज को जो है वो टर्न अराउंड करना होता है, कभी एक साइड पर कभी दूसरी साइड पर। इसके लिए आप अपने जीपी से, फिजियोथेरेपिस्ट से जो है वो आपको हेल्प होनी पड़ेगी। फिर इसी तरह स्पेशल मैट्रेसेस मिलते हैं कि जो इस हवाले से प्रेशर सोर का रिस्क कम करते हैं। Let's move to the next question, which was from Asif Bhai. And now, clearly, when an elderly patient goes into hospital, the doctors sometimes they use this sort of rule, or they tell the family members that end of life care or palliative care. So family members really struggle to understand what is this end of life, and the doctors tell them that we're not going to treat them. And family members think that, so simply they are letting them die. So what is end of life or palliative care pathway? Just educate us a little bit, and that will be the last question before we come to the close.
Yeah, I can touch upon these palliative care and end of life. These are the patients, like what it is. If they have got a cancer or a chronic disease, we can give the prognosis of the patients. Then in prognosis, we can tell them like it could have 6 months or 1 year or 3 months. If it is around 3 months, then this is the time, 3 to 6 months. This is time we involve the palliative teams. and their palliative hospice as well, which do the treat with the palliative patients. There are some nursing homes, or they can go back to their homes as well, and these are end of life cares, and we have to do these all decisions in obviously the family members. So what happens with these patients, that we believe that they are not going to last long, they have got last days of life, or our medication is not going to affect them, or our machines, the ventilator and all these intensive machines are not going to help them to bear, because their organs, the body organs, they are not responding well. Like the one or two body organs, they might be already dead, or they might be have got very low functional power. So then we decide about these patients, looking at their disease, their condition. We say that this is the either the end of life care or palliative. So this is the time when we need to involve, let the family members know that this is the time you need to look after them, and you need to be with the with your patients, with your end of life patients, with your family members, and support them, because obviously the treatment things is out of our hands. We can't treat anything now. This is the time they need support, they need palliation. This is called palliation.
जज़ाकल्लाह खैर। अच्छा, इसमें उर्दू में भी अगर ज़ाहिर है मैं भी बाय प्रोफेशन डॉक्टर ही हूँ, तो मेरा भी यानी कि ओल्ड एज साइकियाट्री में क्लिनिकल एक्सपीरियंस है। तो बाज़ दफ़ा क्या होता है, फैमिली को समझ नहीं आती कि यार ज़ाहिर है उनके जज़्बात होते हैं, एहसासात होते हैं कि यार हम चाहते हैं कि हॉस्पिटल में हमारे लव्ड वन्स का इलाज किया जाए। बूढ़ी माँ है, बूढ़ा बाप है। तो देखिए प्यारे और मोहतरम इस्लामी भाइयों, हर इलाज का ना साइड इफेक्ट्स होते हैं। अब देखो इन्फेक्शन होता है, एंटीबायोटिक्स लेते हैं, तो अच्छे खासे को भी एंटीबायोटिक साइड इफेक्ट्स करती हैं और उन्हें भी प्रॉब्लम्स होती हैं, और वो पसंद नहीं करते एंटीबायोटिक्स लेना। तो इसी तरह हर इलाज का जिस्म के ऊपर नेगेटिव इफेक्ट भी होता है, और जो हमारी उम्र बढ़ती है ना, तो इससे जो है वो क्या होता है कि खामखा बाज़ दफ़ा तकलीफ में इज़ाफ़ा हो जाता है मरीज़ की। अगर हम उनको एंटीबायोटिक्स देंगे या एक्टिव इंटरवेंशन जिसको हम बोलते हैं कि उनका जो है वो इलाज करने की कोशिश करेंगे, तो मज़ीद उनकी बॉडी को दवाइयों से और दीगर तरह की से उनकी बॉडी पर इफ़ेक्ट होगा, मज़ीद उसमें प्रॉब्लम हो सकती है। और जो वो टाइम समझें कि ज़्यादा क्वालिटी वाला टाइम होगा, वो ट्रीटमेंट की वजह से पुअर क्वालिटी का हो जाएगा और जान भी नहीं बच पाएगी। यहाँ पर डॉक्टर्स का तजर्बा काम आता है। तो बहरहाल ये चंद बातें हैं कि डॉक्टरों की ज़ाहिर है बाज़ दफ़ा हमें समझ नहीं आती, लेकिन जहाँ समझ ना आए वहाँ पे भी हमें जो है एहतराम के साथ, एक तहम्मुल मिजाजी के साथ, बाज़ दफ़ा फिर लोग डॉक्टरों से लड़ना झगड़ना शुरू कर देते हैं, और इसमें हमारे दीन इस्लाम की भी हवाले से भी जो है वो फिर बाज़ दफ़ा उँगलियाँ उठती हैं कि हम इस तरह कर रहे हैं, यूँ कर रहे हैं, इस तरह कर रहे हैं। ज़ाहिर है डॉक्टर एक है, उसका पूरा शोबा है कि मरीज़ को बचाना। लेकिन जहाँ डॉक्टर को पता है कि यहाँ अब मरीज़ के बचने की उम्मीद नहीं है, और एक्टिव इंटरवेंशन करना मज़ीद मरीज़ के लिए जो है वो प्रॉब्लम का बायस बनेगा, तो वहाँ डॉक्टर फिर उन्हें कहते हैं कि अब नेचुरल जो इनका बॉडी फाइटिंग सिस्टम है वही करेगा। अगर जब वो कामयाब नहीं होगा तो ज़ाहिर है कि एक मौत का वक़्त जो है वो मुकर्रर है। अच्छा, बाज़ दफ़ा कुछ मरीज़ जिनको एंड ऑफ लाइफ केयर पे डाला जाता है वो रिकवर भी हो जाते हैं, ऐसा भी होता है, लेकिन ऐसा बहुत कम होता है। तो चले आज के लिए दिस इज एंड ऑफ टुडेज सेशन। डॉक्टर इमरान, थैंक यू वेरी मच, दैट वाज वेरी इंफॉर्मेटिव। आई लर्नड quite a few new things as well, and inshallah we'll be back with Dr. Imran on Friday as well, so do watch us. We'll be coming back with another topic about elderly patients. So do like our Leicester Fazan Medina Facebook page, share it with others as well, and inshallah Zawajal will be back live again. We've got thanks from Ilyas Bhai, Riaz Bhai, and other Islam brothers. Sallu ala Habib sallallahu ta'ala ala Muhammad sallallahu ta'ala sallam, and do keep watching Madni Muzakara of Sheikh Tariqat Amir al Sunnah just around 6:30 onwards. Inshallah, see you on Friday, Dr. Imran.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh.